Hello, everybody. We are going to be going over chapter 9, which goes over behavior therapy. So, behavior therapy is a form of psychotherapy that emerged in the 1950s and 1960s as a reaction against the perceived limitations of traditional psychoanalytic approaches. It is rooted in the principles of behaviorism, which emphasizes the importance of observable behaviors and environmental factors in shaping behavior. Behavior therapy is often goal-oriented and focuses on identifying and modifying specific behaviors that are causing distress or impairment in the individual's life. So behavior therapy is you're literally focused on the behavior at hand and how do we change said behavior. Behavior therapy is also like one of the more common ones that you're going to see, especially with children. Or if you work in substance use, that's also a common place that you'll see it. So we're going to kind of explore what that is, but you all will probably be pretty familiar with a lot of these concepts. So behavior therapy draws heavily from learning theories such as classical conditioning, operant conditioning, and social learning theory. So classical conditioning explains how phobias can develop through association, while operant conditioning focuses on how behaviors are strengthened or weakened based on their consequences. Unlike traditional psychodynamic approaches, behavior therapy prioritizes observable and measurable behaviors over unconscious processes or past experiences. This approach recognizes that behaviors are influenced by environmental cues, which is a reinforcement of structures and social learning processes. Changing the environment can lead to changes in behavior. So what you're really looking at in behavior therapy, right, is like understanding, what is causing these behaviors to continue, right? So those different conditionings that were talked about. Also understanding like what are you observing within the behaviors, and what is kind of coming out of that. So, some of you all have probably seen the iceberg picture, and I probably should have used that on here. It would make a lot of sense, but it talks about how, what you're observing is a small part of the iceberg versus everything else that's under it, right? And what we're really trying to get to is everything else that's under it. And then also understanding too that like environment can lead to a lot of the behaviors as well. And so sometimes, there's been a lot of new studies coming out about like the lighting in classrooms, and how that lighting can really like make some people agitated, uncomfortable, restless, and that can lead to a lot of behavior issues. So some key figures in behavior therapy is B.F. Skinner. So Skinner's work on operant conditioning laid the foundation for behavior therapy techniques, such as reinforcement and shaping. You also have John B. Watson. Watson's emphasis on observable behavior and the environment's role in behavior influenced the development of behavior therapy. You also have Pavlov, which is the classical conditioning. You also have Joseph Wolpe. Wolpe's development of systematic desensitization revolutionized the treatment of anxiety disorders by exposing individuals to feared stimuli in a controlled and gradual manner. You have Bandura. Bandura's social learning theory introduced the concept of observational learning, where individuals learn by observing others' behaviors and their consequences. So some techniques and methods within behavior therapy. You have systematic desensitization. So this technique involves creating a hierarchy of anxiety-inducing situations and gradually exposing the individual to these situations while teaching relaxation techniques to manage anxiety. Exposure therapy. So in exposure therapy, clients are exposed to feared stimuli or situations directly, helping them confront and overcome their fears. You have aversion therapy. This technique pairs undesirable behaviors with unpleasant stimuli to reduce the likelihood of those behaviors occurring again. So, an example of this could be pairing alcohol consumption with a nausea-inducing drug to deter drinking, right? Token economies are commonly used in institutional settings Token economies involve rewarding desirable behaviors with tokens that can be exchanged for privileges or rewards. So like where I work at, they have like this these different types of percentages, and if you're like in the 85% club, you get X, Y, and Z. I think it's like one scoop of ice cream from Baskin Robbins at the end of the week. And if you're in like the 100% club, you get 2 scoops and whatever toppings you want, or something like that. Contingency management. This approach modifies behavior by altering the consequences. Positive reinforcement is used to increase desired behaviors, while punishment or extinction is used to decrease unwanted behaviors. Then you have modeling. Therapists demonstrate desired behaviors for clients to observe and imitate. Particularly, this is useful in teaching new skills or social behaviors. And then you have behavioral activation. This is used primarily in treating depression. Behavioral activation encourages individuals to engage in pleasurable and meaningful activities to improve mood and motivation. So some applications of behavior therapy. Behavior therapy is widely applied across various different diagnoses. Some of those diagnoses could include anxiety, depression, obsessive compulsive disorder, substance abuse, eating disorders, ADHD, and conduct disorders. And so this kind of goes into, different ways that you can treat those different disorders. So let's say you decide to use behavior therapy for your signature assignment and your client struggles with anxiety disorders. What are, some ways that you could integrate behavior therapy for those anxiety disorders, especially like phobias? One of the things that they talk about is through exposure-based therapy, right? And doing the, getting them to face their fear or stimuli in small increments, right? And like what's going to be helpful for that. But then also like using relaxation training and different things like that, just to work on changing the behaviors that are associated with some of the symptoms that may come up for them. So what is the counselor's role versus the client's role? So the counselor conducts thorough assessments, collaborates with the client to set goals, designs and implements interventions, monitors progress, provides feedback, and adjusts treatment as necessary. So there really isn't a whole lot that's different in the counselor role outside of what you would expect. And then you also have the client, who should actively participate in therapy, commit to treatment goals, practice new behaviors outside of sessions, monitor progress, communicate openly, and provide feedback on their experiences. So one of the biggest things that you should be aware of when it comes to the client's role in behavior therapy is, without them being completely bought in on utilizing the new behaviors and practicing them and then communicating that back with you, it won't be as effective. So what's the effectiveness of behavior therapy? Behavior therapy has demonstrated effectiveness across a range of mental health disorders, with numerous empirical studies supporting its efficacy. It is often recommended as a first-line treatment for specific disorders such as anxiety disorders, due to its evidence-based nature and focus on measurable outcomes. So like I said, it is very widely used. It is often a first line of defense, so to speak, for a lot of people, just to kind of get in the door. What are some advantages and limitations? So some advantages, behavior therapy is empirically supported. Like I said, it's widely known, widely studied. It's goal-oriented, it's practical and structured. It emphasizes measurable changes and can produce rapid improvements in targeted behaviors. So while, of course, it has its advantages, what are the limitations? Critics argue that behavior therapy may overlook underlying psychological issues, lacks a holistic approach, and may not suit individuals who prefer exploring deeper emotional issues or past traumas. So remember, behavior therapy is focused on the here and now, right? So what are the behaviors that's happening? Why are they happening? And how do we change them, right? Like we are focused on changing those behaviors that are currently happening. So if you have someone that's wanting to explore past traumas, you're not going to get a whole lot of that out of behavior therapy techniques. Okay. So behavior therapy is a versatile and effective approach that addresses a wide range of psychological issues by targeting specific behaviors and utilizing evidence-based techniques. Its emphasis on learning principles, collaboration between the client and therapist, and measurable outcomes makes it a valuable therapeutic modality in the field of mental health. So it is a good technique to use. It's a good approach to use. I work in substance use, and so behavior therapy is often something that I do resort to. Um, and it is something that you can see changes almost immediately as long as the client is bought into it. So, I hope this has given you a good overview of behavior therapy. And as always, if you have any questions, don't hesitate to reach out. And I hope you all have a good week.